This solution is used to treat specific severe fungal infections. It is an azole antifungal medication that stops the growth of fungi. It is important to take this medication as directed by your healthcare provider. This medication may be taken with or without food. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. It is important to take this medication at the same time each day. Be sure to continue taking this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Before you start using this medication, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is given through injection into a vein as directed by your doctor, usually every 8 hours for the first 6 doses, 48 hours. After the first 6 doses, it will be given once daily, 12 to 24 hours later. It should be injected slowly over 1 hour. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. It's important to use an inline filter with this medication. It is normal for this product to have white particles in the liquid. Before using, check this product visually for other particles or discoloration. If either is present, do not use the liquid. Also, learn how to store and discard medical supplies safely. If you are giving this medication through a nasogastric tube, ask your healthcare professional for detailed instructions on how to properly mix and give it. This medication works best when the amount of medicine in your body is kept at a constant level. Use this drug at evenly spaced intervals. It's important to continue using this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition does not improve or worsens, make sure to inform your doctor. As with any medication, isovoconazonium sulfate solution, reconstituted, Recon-Soln, may cause some side effects. These can include nausea, vomiting, diarrhea, headache, constipation, cough, trouble sleeping, dizziness, fainting, trouble breathing, chills, numb/tingling skin, changes in your sense of touch. Your doctor will monitor you closely and will stop your treatment if a reaction occurs. However, it's important to remember that this medication has been prescribed to you because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If you experience any serious side effects, such as muscle cramps/spasms, weakness, irregular heartbeat, swelling hands/ankles/feet, back pain, mental/mood changes, or signs of kidney problems, you should contact your doctor right away. Additionally, isovoconazonium may rarely cause serious liver disease. If you experience symptoms such as nausea/vomiting that doesn't stop, loss of appetite, stomach/abdominal pain, yellowing eyes/skin, or dark urine, you should seek medical help immediately. It's also important to be aware that isovoconazonium can commonly cause a rash that is usually not serious, but it's important to inform your doctor if you develop any rash. While a very serious allergic reaction to this drug is rare, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, you should seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Before taking isovoconazonium, it's important to let your doctor or pharmacist know if you have any allergies or if you have a history of liver disease or certain heart problems. This medication may cause dizziness, so it's advised to avoid alcohol or marijuana, which can make it worse. It's also important to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, especially before having any surgery. If you are pregnant or planning to become pregnant, talk to your doctor about using reliable forms of birth control while taking this medication. It's also recommended to avoid breastfeeding while using this medication, and to consult your doctor before doing so. When taking isovoconazonium sulfate solution, reconstituted, it's important to be aware of potential drug interactions that could affect how this medication works. This includes other medications that may slow down the removal of isovoconazonium from your body, which can impact its effectiveness. Some examples of these medications include certain HIV protease inhibitors, rifamycins, and drugs used to treat seizures. On the other hand, isavuconazonium can also slow down the removal of other medications from your body, affecting how they work. Some examples of affected drugs include isoniprevir, bosutinib, and tolvaptan. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. And remember, never start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much isavuconazonium sulfate solution and is experiencing severe symptoms such as losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. It is important to undergo lab and/or medical tests, such as liver function, while using isavuconazonium sulfate solution, reconstituted. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of isavuconazonium sulfate solution, reconstituted, Recon-Soln, at the scheduled time. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. It's important not to double the dose to make up for a missed one. Be sure to follow the storage instructions provided with the product, and keep it out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it down the drain unless directed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.